3.
Marijuana is one of the most commonly used drugs in the United States. However, many people have never heard of it. It is a plant that produces cannabis, which is used to produce hemp, which is used to produce many different products. Many people use marijuana for its medicinal benefits, such as treating pain and reducing nausea. Many people have used marijuana in an effort to help alleviate their symptoms, including pain, nausea, and other conditions. However, the evidence is conflicting and it is unknown whether marijuana is truly helpful. Given the conflicting evidence, this video will attempt to answer the question by analyzing the biggest studies on marijuana and health, as well as some smaller studies. The whole first thing to keep in mind when analyzing marijuana's health effects is the wide range of conditions that it can treat. Cannabis is used to treat pain, nausea, and other symptoms associated with a wide variety of conditions. It is also used for recreational purposes. The evidence overwhelmingly suggests that cannabis is not very effective as a medication and is maybe useful to people as a recreational drug. When it comes to pain, marijuana reduces the sensation of pain in the user. This is primarily due to cannabinoids interacting with the cannabinoid system in the brain, which is often used to be called the pleasure sensors in the brain, but is actually a system that regulates the body. The cannabinoid system has a number of important functions, including the regulating the amount of pain that you feel and regulating the amount of THC in the body. The cannabinoid system also has a role in appetite, metabolism, mood, and sleep. Marijuana can also help people with epilepsy. Marijuana has been shown to be effective at reducing the number of seizures in people with epilepsy. The cannabinoid system is responsible for regulating the amount of pain you feel and has a role in regulating the amount of THC in your body. The cannabinoid system is part of the pleasure centers in the brain, which are responsible for generating feeling of pleasure. When cannabinoids interact with the cannabinoid system, they are able to stimulate the pleasure centers in the brain, which results in the feeling of pleasure. That study shows that epileptic activity is related to changes in the levels and distributions of cannabinoid receptors in the hippocampus. The cannabinoid system is a group of chemicals and receptors present in the brain of all vertebrates and includes two types of receptors known as cannabinoid 1 receptors and cannabinoid 2 receptors. These receptors are found throughout the nervous system and the main targets of the cannabinoid system. With marijuana, with pain and epilepsy, is also beneficial to relieve nausea and vomiting in chemotherapy patients. Studies have shown that marijuana is effective at reducing the number of episodes of nausea and vomiting in chemotherapy patients. This is known as the cannabinoid hypothesis of nausea and vomiting, which states that when cannabinoids are consumed, they are able to reduce the feeling of nausea and vomiting. Another study showed in 2001, patients who smoked cannabis shed 70 to 100% relief from nausea and vomiting. Ever heard of dystonia? Dysthenia. It is a condition that causes involutionary muscle contractions that result in a movement disorder. It is a neurological condition that causes controlled muscle spasms and results in repetitive, uncontrolled movements. It is also sometimes known as involuntary muscle contractions or involuntary muscle spasms. The science-based movement disorder affects approximately 1% of the world's population and can occur at any age. In 1986, has found out that the daily intake of CBD with standard medication improved dysthenia up to 50%. It can help reduce nausea and vomiting and caused by chemotherapy. Marijuana can also be used to treat muscle and joint pain. It can provide relaxation. In one study, some cancer patients who used marijuana to help cope with their treatment reported that it helped them better manage their pain and anxiety. With all these benefits, marijuana should it be legal in all states? The simple answer is yes. It has been shown that the wide variety of psychoactive drugs and medical cannabis can help to alleviate symptoms of numerous medical conditions, including anxiety, stress, pain, and other nauseas, by helping to manage them naturally. And it is not just about getting high. The many potential medical benefits of cannabis are just as real.